Part 1 of As an Emergency Physician. What is the strangest case you have ever encountered? One night in the year, a 42-year-old lady came in with severe abdominal pain and nausea. She wasn't vomiting, no other symptoms or problems, except for multiple prior visits to the ER with the same problem. Many doctors had tried and failed to diagnose and treat her. She had been to all the specialists at all the regional universities. The famed Cleveland Clinic even took a crack at her. All the tests were negative, including blood work, poop samples, x-rays, scopes in both ends. The camera pill, a camera that the patient swallows. It takes pictures as it traverses the gut and various scans. She had CT scans, MRIs, and various nuclear scans. There were scans with and without fore contrast and oral contrast. There were scans of her arteries and scans of her gallbladder. Her gallbladder was a little weak, so a weak surgeon jerked it out without any benefit. She had every blood test for cancer known to man. Multiple biopsies were always negative. I thank God that no tired pathologist ever imagined any cancer cells under the microscope. This lady already suffered so much at the hands of her healers. X-rays were done many times, with and without barium. Some of the X-rays were done as videos. She might have had enough radiation to kill any tumor. And the scopes. Multiple scopes down the throat and into the stomach and duodenum. Another scope down the throat, through which a catheter is passed, into the bile duct and pancreas to inject. Contrast that. Highlights the ducts for more X-rays. A urologist even scoped her bladder. She saw stomach specialists, liver specialists, gastrointestinal surgeons, kidney specialists, urologists, neurologists, and even psychiatrists. There's an old saying in medicine, if the only tool you have is a hammer, then everything looks like a nail. This poor lady had been beaten with every specialist's hammer in 3 states. When they couldn't diagnose her, they just skipped straight to the cure. She failed multiple curative procedures and dozens of medications. There were medications to neutralize acid, coat the stomach, decrease acid production, antispasmodics, anxiolytics, antidepressants, antibiotics, anti-seizure, antifungals, and plain old pain medications. She learned to refuse the pain medications because she was smart enough to realize that she would be written off as an addict, that doctors stop trying if they think you just want opioids. She has been put on every dietary restriction and treated with every fiber supplement. She knew it all because she had tried it all. Part 2 up now.